Jason, how you doing?
Abel, thank you for having me.
It's a pleasure to have you here, man.
Appreciate it.
How you feeling?
Feeling good. Excited to be here.
So I gotta ask, how long have you been with Crouse?
A little over a year. I started in July 2024.
Oh, so you're still a newbie then.
Still a little bit newbie, but learning a lot. I'm really loving it there. It's a great environment, caring, passionate team, and wanting to just provide the best care in the community.
So where do you come from, Jason?
I worked at a company called Helio Health.
Okay, I'm familiar.
So providing mostly addiction treatment services.
Yeah.
So I've been doing recruitment and HR for almost 10 years now.
Wow.
And so found my way to Crouse in a bigger opportunity and able to impact more of the community and have under our purview as far as care that we can provide from what I'm used to, just as far as learning about the medical field and care that's needed for the community. It's been really exciting to learn and just kind of in that role. So
awesome. So for somebody that might never been to Crouse, doesn't know what the culture's like, how would you describe the atmosphere and the environment at Crouse compared to anywhere else that you've been to?
Yes, Crouse is really like a big family. It knows each other's names. Everyone's friendly with one another. It's very collaborative, easy to get in touch with people and work on projects and see results. I think everyone's really driven to do the best job. And we have similar goals as a team. We want to do the best our own teams to put out the best product, right? And that's providing the best care for patients in the central New York area. So it's collaborative, a lot of good communication within, definitely like a family for sure.
So that's something I can actually testify to because as a patient, my wife and I are a child. So all of our kids were born at Crouse. And
That's amazing.
Our third child, we had it in the car. We didn't make it to the hospital.
Oh my gosh.
So we were off the exit before, I forget what it is, it's Adams Street, I think it is. And we had the baby in the car.
Oh my goodness.
So by the time we got to Crouse, by the ambulance and everything, by the time we got to Crouse, I can tell you for a fact that the communication was huge. People were waiting for us.
Yeah.
The EMTs, like it was such a collaborative team. We made it, to the emergency entrance, all the way to, he went to a NICU because he was born in very conditions in the car, and he was there for a few hours. And then my wife, she was admitted into our room. And the communication and the care that we had at Crouse, I have some bias because I haven't been anywhere else, but I can tell you as a patient, I noticed that the communication aspect, which we all know can be a huge thing if the right hand doesn't know what the left hand is doing.
Amazing story. That's incredible. I think that's the thing we try to focus on is communication. In some of the most significant of your life, it's a healthcare crisis at times, whether it's a baby or you're experiencing stroke, things like that. So we always try to communicate well. We try to act as quickly as we can. We try to provide the best care. And I think it's important, the team and our staff relays information appropriately to who come in to receive care with us. So that's incredible that worked out that way.
Yeah, it was an amazing story that I'll never forget. It was one of a kind experience during COVID too. So it was like everything happening at once.
How old are the children now?
So now the one that was born in the car, he's 5 now.
Okay, wow.
It happened right 2020 when the pandemic happened.
Amazing story.
And amidst everything that was going on in the middle of the pandemic, when we were still figuring out what to do, they still took the time to care for us as a young family. Then everybody was, it's just an amazing experience. So I got to ask, Jason, I've been hearing a lot about the short staff. We're actually short staff here too. If you're looking for a job, let me know. But to me about the and how that has affected Crouse, and is there any specific areas or positions that you might be looking to fill faster than others?
Sure. Yeah, you mentioned the pandemic, and COVID, I think, really put an emphasis on healthcare, and the need for healthcare as a result after the pandemic has really grown and ballooned more so than we could have predicted. So definitely shortages for and trying to, nursing staff is a primary focus for us. That I think state really is prevalent across the country. Really, there's pretty much anywhere, but that's been a priority for us, and we have of Crouse for nursing. So whether you're looking for medical, surgical, ER, ICU, NICU, as you mentioned, so we have opportunities really in any specialty, which there are great options available for those who have nursing backgrounds, whether they're new grads or experienced. There's different potential areas to explore. We offer shadowing opportunities as well, so you can kind of see what a day in the life looks like being a Crouse nurse. we think that's important to really kind of peek curtain, if you will, to see what is like and if it's something that you know for you. So we try to work really closely with people to we're providing the best fit, but it definitely it's competitive field, very needed field, and it's one that I'm passionate trying to fill. Just fulfill kind of Crouse, just to provide the best inpatient care.
So talk to me about incentives. Say I'm a registered nurse. I'm looking at options available out there. Obviously, everybody's hiring.
Sure.
I'm being the best collaborative team, but
Yeah.
I'm also looking at my own benefits
Certainly.
as a nurse. So
Certainly.
talk to me about some of those incentives and how Crouse is set apart from everybody else.
Absolutely. We did just increase our pay scales.
Okay.
So pays as of this summer have increased. So they're definitely more competitive than they were. We have a really good benefits package. The benefits package is extremely comprehensive. It's cost effective. Things that are completely covered in full that ordinarily under different coverages and plans, quite a bit. So being a Crouse employee on our package is unbelievable. It's in the area probably the best package that you can find. Not biased. I'm just we've done our research. We know it's a very competitive, very good plan. We do a lot to make sure that we offer very competitive shift differential for those working evenings, overnights, weekends, on incentives. So whether you're a new graduate or experienced, we offer sign-on bonuses. For new, we do offer some loan repayment as well.
Wow.
We have tuition repayment options available. And then we do a lot just as far as developing our staff. We have a tremendous team doing workforce development and education, providing opportunities for people to grow, and their own learning and ability to provide better care, to move into higher level roles, leadership, nurse practitioners, physician assistants, kinds of different things.
Awesome. So that's got to be a big part of it, right? Talk about in the future and growing the company. Are there any nursing programs available at Crouse at this second?
Nursing education?
Yes.
Yeah, so we have our Pomeroy College of Nursing, which provides a 2-year associate's degree in nursing. And so that's great. Have basically, and along with that, we have positions available. So there's, an assistant position. It's for anyone in a college program, but those at Pecan, really well with our, so a student nursing assistant job is a per diem position where people can be in school, taking classes and going through that process, but also working and gaining experience, building their resume, seeing what units are in real time and trying their niche, working environment like that where they can, so there's that educational opportunity. And then we have academies as well for nursing. So we have academies for our operating room, labor and delivery academies, NICU academies. So they're designed to provide a lot of education, growth, and development for people who may be newer to the field or even experienced, really.
Right.
We want to feel well-oriented, right? To have a good foundation of knowledge, providing care, being on a unit, and to have that level of independence. And we make sure we take the time, we pair them with, who have done the role, who have been involved in for some time, to set everyone up for success. That's the name of the game. We want to have everyone set up for success. We want them to feel prepared and trained. So right from the beginning, from when they're obtaining their degree, whether that's through the Crouse College of Nursing or elsewhere, a nursing assistant job, right on through to being a full-fledged RN. We try and really set everyone up to have best education and preparation.
Awesome. So Jason, let's pretend that I'm a high school. I'm not planning to go to college for now.
Sure.
I was laid off during COVID.
Okay.
So I know what's an essential business and what's not an essential business. And because I don't know what to do with my life yet, I want to be like, you know what? Maybe I should try healthcare. Are entry-level positions at Crouse that I can get into without a college degree?
Absolutely. A position is excellent. Really, all you need for that is some in patient care. It's a role to really get your foot in the door and to learn and to see and to experience the healthcare and really find out what a day in the life looks like. There are positions as well. At times we'll have positions like phlebotomists, patient care. There are transporters who help, bring different areas of the hospital if they're receiving treatment in different areas, getting them to and from their room. A number of things that people can, learn more and grow. And definitely we've seen people who have started in that nursing assistant track who have loved it, who have, developed for it, who have then gone on to get their RN and move in that role. So it's exciting to see. There's other opportunities as well. Has so many different roles outside of healthcare specifically, but positions that you could start in that you could eventually move into a healthcare setting if you kind of want to get that initial experience and get your foot in the door.
Awesome. So all those that you gave me are examples that I could get into as an entry-level position, right?
Certainly, yeah. I think there for of experience in the field. If there's been healthcare that's typically desirable, but in most cases, we're good for who are just willing and motivated to provide great care and take the steps to learn and develop themselves and make sure that they're doing their proper research on what position looks like.
So Jason, we are a nation of immigrants, right? And I'm sure that there's a lot of immigrants out there that may have had a medical background in their country.
Sure.
Maybe even education. Maybe they were a successful doctor in their country, but now they move to America and they don't have that validation. They don't have that degree other than their certificate from the country that they came from.
Sure.
Are there opportunities at Crouse that will take into consideration previous experience from a different country, for example?
Yeah, some of the roles that we have, we licensure specific to New York State, and that's just kind of, the guidelines that are for some of the positions that we have. So, if someone to convert their experience into the appropriate licensure for New York State, then absolutely, we can certainly work with them. And for those who are working through immigration, we do have opportunities available to provide some help with that process as well.
Amazing. What does those sponsorship look like? Is it like a letter of recommendation, job employment, or?
So, through it, available, where we can to continue their employment and maintain their citizenship in the country while they work through obtain official permanent citizenship as well.
Okay.
And we can assist with process.
Cool. Now, what about, maybe we don't have to be like super specific, but is there a number of positions you're looking to fill by the end of the year or by the next 3 months so that people out there feel like, oh, I'm out, or maybe they already reached their goal? Like, what does that look at this time?
It's a great question, and the goal is really, I think, retention of it. We want to retain, we would as many positions as we can. We know that, people will, right, there's natural turnover, people they move up,
right,
they move away, and so there's going to be open positions, right? I don't think we'd ever really be in a position where everything is full. It's a little, our goal is fill positions and with right people, people that vision value that Crouse has. And so, if you're in and looking to develop and give back and work in a community that, is you do, then Crouse is a great spot. And there's a lot of learning, development opportunities. They really invest people to the point where people feel valued and want to continue and have long-standing. A lot of people at Crouse have been there for a long, long time, and it's why, because you get being an employee there.
Well, I was going to ask you to just say a final word and why they should join Crouse, but I think you just summarized it very well with what you just say. And hashtag take.
Thank you very much.
I don't even know what else how to end. That was just a great summary there at the end.
Thank you. I appreciate it. It is a wonderful place to be. It's, of course, my position being the manager of talent acquisition and retention, I do not provide direct patient care. I'm not in healthcare myself. Right. But, being with those do and help support the mission in my indirect way, it's extremely rewarding. It's a very rewarding field being in healthcare. And that's any way you look at it. So, there's like different facets of Crouse and types of opportunities that will be available now and to come through the next few years. So, being able to and work with an organization that's goal is to people healthy and keep the community. It's extremely rewarding, like no other employment I've ever had in my life.
Wow, I think you hit the nail on the head because, you're in a position where you're the person responsible for hiring the talent that's going to help the company grow, but it's the people that are taking care of our community. So
exactly,
it's like you're like, and so that's, I don't know, but a big weight on your shoulders, like, hey, I'm making the right decision and hiring the right person, like you were saying. Yeah. But it's got to
yes.
When you see, how they start maybe at an entry level position and then they grow up to be something else in the company.
Absolutely.
So thank you for being, Jason.
Thank
man.
you, Abel.
It
was great to meet you. Great. If you need scrubs and clothes, come to Bayberry.
Oh, there you go. I didn't ask him to say that, by the way. But thank you.
Thank you.
We're happy to support. As you can see, I'm wearing the Crouse t-shirt. #1 bestseller. Can you believe it?
I can.
Tie-dyes.
Oh, it's great. We see them all around the hospital all the time. I love it.
Yeah, I was hoping you mentioned something when I asked
Yes.
about the culture at Crouse, because that is something that is very particular to Crouse.
Yeah.
You see them wearing tie-dyes everywhere.
It's great. It's great. It's a little bit of a glimpse into the life at Crouse. We're fun. It's a great environment. It's laid back at the same time.
Yes, absolutely. Well, there you have it, guys. Jason with Talent Acquisition at Crouse. Please reach out. I'm going to leave a link down below for the job fair and careers at Crouse. And I mean, like I said, great place. I've been there as a patient. You heard it from the man himself. So any questions, feel free to reach out. Abelman and Jason from Bayberry and Crouse Health. Thank you.